This is all about finasteride, or the better known brand name Propecia, which is a 5-alpha reductase inhibitor, why you should care, what you need to know, how does it work, and more importantly, what are some of the possible side effects. DHT works at the hair follicle. It's a metabolism or metabolite of testosterone, if you will, and it causes miniaturization and breakage of hairs, which can result in the classic male pattern baldness appearance. I want to point out that this is an informational only presentation. As always, you want to consult your provider, practitioner, doctor, physician assistant, nurse practitioner, whomever prescribed this medication or any medication to get specific advice to your particular situation. This presentation does not establish any relationship, doctor, patient wise or other, which is a common misconception because I get a lot of questions at the end of these videos that I just cannot answer safely in the context of the internet. So side effects, I'm just going to share some side effects of a medication, and I want you to just hazard a guess if you can think of what it might be. So the side effects of this medication, which is used by millions of Americans every day, include blindness, heart attack, stroke, kidney failure, death, intestinal hemorrhage, among many others. Any guesses? This is ibuprofen. While these side effects may be rare, they have to be disclosed, as do all side effects of medications based on drug trials and FDA regulations. So keep that in mind as I share some of the data on this drug. First and most importantly, this is not for females with hair loss. I have unfortunately encountered several females who have tried this before, and it's not for females, particularly those who are childbearing or with child. It works on hormone metabolism, which can have disastrous consequences, particularly for an unborn male child. It's not for everybody either. People with liver problems, kidney problems, prostate cancer should not take this medication. It's important to point out, particularly in light of where we are in 2021, that this medication can increase the risk of depression or depressive symptoms. It's not a huge percentage based on the data, but for those that are predisposed or maybe already suffer from depression or anxiety, this drug can exacerbate those side effects. Less commonly would be severe allergic reactions. Like any medication, this can cause itching, hives, swelling, rashes, trouble breathing, dizziness. All those signify a significant allergic reaction, and immediate medical care is required. This is a controversial topic. There are some that absolutely swear it's a reality, and there are others that think that it's more of a mental health concern. But I'll leave it to discussion with the prescribing provider, but I believe it's a real entity. It's very rare. There are, as I mentioned, conflicting data. There are 73 papers that were done on reviewing benign prostatic enlargement, and what they found in that study was that the incidence of sexual problems range anywhere from 3 to 5%, depending on what we're talking about. So a decrease in libido, maximum of like 5%, some problems with erection, anywhere from 4 to 15%, which is pretty significant, and problems with ejaculation, anywhere from 2 to 7%. There are some other studies that are very small, where they're looking at just 71 men versus much larger studies that are looking at 17,000 plus men. And in a larger long-term study, looking at some of the side effects of finasteride, which should include decreased libido, erection problems, and ejaculation problems, the conclusion of this data set was that less than 2% of men actually have side effects as mentioned. And these side effects generally go away when they stop the drug, and by the 5th year of stopping the medication, the chance of having a side effect was less than 0.3%. So pretty tiny, not zero. Obviously, if you're one of the 0.3 people that are experiencing this, it is an issue, but just keep that in mind. There are a variety of data points out there. Some research is not always done scrupulously, or doesn't have what's called the power. There's just not enough number of people that are studied to really generate any conclusions that can be extrapolated to the general population. Do not donate blood. If you take this medication, please do not visit a donation center. This is critical to point out. So typically, most providers will use 1 milligram of finasteride for hair loss treatment. Many patients think that higher doses are better. Keep in mind that it's not approved for that. The 5 milligram dose is typically a prostate enlargement dose, but it's not without risk. There are some data that there can be an increased risk of serious high-grade prostate cancers to develop, particularly for men, using this medication, and it can alter the PSA, the prostatic-specific antigen, that is typically measured by your local doctor at an annual physical. So make sure that the prescribing person and also the person evaluating you for lab work is a clear understanding of all the medications, including supplements, being taken. Men, unfortunately, can suffer from breast cancer. I've had a handful of men in the last 20 plus years that have required mastectomies for breast cancer issues, which were unrelated to finasteride. But keep in mind, because of finasteride working on the testosterone metabolism pathway, that it can at times increase the risk of breast cancer. There are a variety of factors that are well beyond the scope of this discussion that predispose men to breast cancer. That's another topic for another day. But various signs and symptoms that can occur because of finasteride include breast tenderness, nipple discharge, breast growth, swelling, tenderness or mass. Anything of that nature needs to be evaluated. Commonly, as I mentioned above, the decrease in sex drive or libido and trouble getting and keeping an erection. This is a complicated topic. A lot of men are under the impression that testosterone is the key driver of erections, and it's well documented from data that men with very low levels of testosterone can still get an erection. So it's not the entire piece of the puzzle. To label it as such misses an opportunity to detect and to treat many other underlying causes of sexual dysfunction. For those that are thinking about childbearing, couples would generally, the advice would be to not start this medication, or if a person is taking it, to stop this medication until conception occurs. And that's just the general advice that is well documented in the prescribing literature for patients. Altering recipes is so common. I deal with this almost daily in my current practice, where the common analogy that if a little is good, more is better, and this is not the case with prescription medications. I've seen many patients get into trouble with some pretty horrific side effects from other medications. Please follow the prescription as given by the prescribing provider. Do not make up your own recipe, if you will. It's just asking for problems, both short-term and long-term. Decreased amount of semen or ejaculate is very common. Men who maybe skipped over that in the prescribing literature or missed it in the discussion with their provider are often shocked or surprised that what's coming out is a lot less than before. This is very common and well known. Any quick search of the literature on the web will show you this as well. Shedding. What is shedding? Shedding is when hair falls out maybe at an accelerated or premature rate. Oftentimes people are shocked or surprised by this. It can be somewhat impressive at times, if you will, depending on the person. And the reason for this is as the drug works at the level of the hair follicle, it can allow a little bit of a push out of the weaker, older hairs, a little bit of accelerated shedding as the hair follicles are rejuvenated, so to speak, and hopefully new hair growth will occur. This drug does not work for everybody. Unfortunately, for some, hair loss is multifactorial. It can be genetics, diet, environmental stress, toxins, heavy metals. There are so many things that go into the equation that it's not surprising that it doesn't work for everybody. Fortunately, with the advance of science and technology, there are new modalities on the market that are very interesting and promising, as well as the tried and true methods. So if there's zero success, certainly visiting a hair loss expert would be an appropriate course of action. The manufacturer of the finasteride drug states that it can take up to a full year to reach maximal results. Many people recommend biotin, which is a B vitamin, as a cofactor for hair growth. So keep that all in mind and always discuss full course of action with your local person. That wraps it up. If you want more content like this, be sure to subscribe. I'll be sharing some links below the video. You can check them out. They are published studies. None of this is my data. And as always, be safe, be well, have a fantastic week.